This is a CBC podcast.
Up next, the Information Morning Candidate Roundtable for Northside Westmount.
Let's say the brakes went. You say, oh, well, I've got a brake problem. I know how I'll deal with that. I'll junk the car.
I think that we have to look at the economy as a whole.
People-driven care, not policy-driven care, people-driven care.
These will help boost the whole economy, which will allow employers to pay more.
The investments we talk about in our platform are significant.
So what we're saying is that the car ought not to be junked.
So it's time to continue with an Information Morning tradition. We have invited all the people in Cape Breton who have put their name forward to represent you as MLA to come on the show in a roundtable format. And today it's the candidates in Northside Westmount. As the name implies, that district takes in Sydney Mines, North Sydney and Westmount, as well as Point Edward, Alder Point and Florence. And in alphabetical order, your candidates are Jennifer Morrison for the NDP. She is a teacher. Murray Ryan is with the Progressive Conservatives. He's a accountant. He's also the incumbent in the riding. And Fred Tilley is best known as principal of NSCC's Marconi campus. And we've got them all on the line this morning. Good morning to you all.
Good morning, Wendy.
Good morning, Wendy.
Good morning. So, again, going in alphabetical order, I'm going to ask you why you're running. And first to you, Jennifer Morrison, why did you decide to throw your hat in the ring?
Well, thank you, Wendy. First, I want to congratulate you on the big swim over the weekend. And I would also like to acknowledge that we are all part of Ugamagi, and it is the unceded and unsurrendered territory of the Mi'kmaq people. Saying that, I've thought about this question so much because it's one of those questions that you get a lot in a campaign, and I think my answer may have kind of switched back and forth a little bit here and there. And the reason for that is because there's so many reasons why I want to do this. Politically, the NDP is a party that I align with in terms of their platform, and I believe in what they want to do for Nova Scotians and Canadians. Personally, I do come from a family where politics has always been very important. We learned early on to think about politics and become active in the political arena. As an educator, I've participated with my students in what's called Canada Votes. So during elections, I receive information from Elections Canada. We go through ballots. We contact people that are running campaigns, and we have them come in to visit, and we actually go through a full voting process in the classroom. So all of those things combined really are why I want to do this. The other reason is because I have a son who's going to be 18 next year. He hasn't yet had the opportunity to vote, but he really wants to, and he's very actively engaged in the political process. But I don't think there's a lot of young people that are as engaged as he is, and one of the biggest reasons why I want to do this is because I do want the younger voters to understand that their vote matters and that their vote counts, and it's so important for them to be active in the political landscape because the decisions they make on a ballot are really their future.
All right. Thank you, Jennifer. Murray Ryan, next to you. You are re-offering because you are the incumbent. Why do you want to hold the position again?
Yes, thank you, Wendy. 2 years ago, when the by-election was called for Northside Westmount, I decided to offer my name up for consideration, and the reasons then are just as valid and just as real as the reasons now. It's healthcare, plain and simple. I'm the primary caregiver for my elderly parents for the past 7 years, and I've seen and I've experienced firsthand the problems in our healthcare system. But I've also seen the very best of it in action from our paramedics, the ER doctors, nurses, and all the healthcare professionals. But I've also seen the worst. The hours-long ambulance offload times, the waiting in hallways, the extended wait times in exam rooms. And it's all it's resulted in overloaded staff. But what really hit me during these many visits to the emergency rooms was that you'd take a moment, you'd go out to get a bottle of water or a pop or a bag of chips over those 8, 12, 16 hours visits to ER, and you'd see people in the waiting room 2 hours, 6 hours, 12 hours later. And that's just wrong. Our healthcare professionals deliver excellent care that's second to none, but the system's being overloaded as a result of our lack of family doctors and the shortage of long-term care beds and the shortage of healthcare workers. And this is all converged to create the significant significant ER wait times that we're seeing now.
All right, Murray Ryan, thank you very much. Fred Tilley, what has made you decide to run for MLA?
Well, thank you, Wendy. And first of all, I'd like to thank you for inviting us today to CBC, and I'd also like to thank and congratulate the other two contestants for the seat in Northside Westmount. It takes a lot to put your name on the ballot. So, Wendy, for me, I've always had a passion for helping people, and that's what's driven me to my career in post-secondary. Spent the last 20 years at NSCC and the last 9 as principal. And it's actually what's driving me to want to become the MLA for Northside Westmount. I believe that I have the leadership skills, the proven track record of bringing investment here to Cape Breton, such as 44 federal government jobs in the Health Canada area, as well as new programming for our students. I believe that my volunteerism over the last 20 years in the community has prepared me well to understand the concerns of our constituents, and I want to take the skills that I've learned through my career and apply them on a greater scale so that I can help Northside Westmount residents to improve their lives and to improve our community. So that's really why I wanted to run, and I think it's our time here in Northside Westmount to be on the government side. We've been on opposition for so long, and we're really lacking in things that could be done here, and I believe that I'm the person to deliver a strong voice at our government table.
All right. Thank you for that, Fred. I want to talk to you all about your priorities. But first, Fred, you mentioned that you think it's time for the riding to be on the government side. What is it about the Liberals in particular that made you want to run with the Liberals?
Well, Wendy, I've always had a connection to Liberal policy, and that is really what has driven me. I've watched this government over the last 8 years make significant investments here in Cape Breton with regard to NSCC, with regard to our new healthcare developments, our new cancer center, which was not supported by some MLAs, but it's going to be a fantastic investment. So the reason I chose this time was that I believe I can be that strong voice to make sure all of these projects are continued and that they're delivered effectively and efficiently, and we will get what we what we deserve here in Northside Westmount.
Now, Murray Ryan, you mentioned that healthcare is certainly one of your priorities. What would you and the PCs do differently to help correct the situation here?
Yes, thank you, Wendy. Our platform is healthcare, healthcare, healthcare. And it starts with listening. It starts with respect. It starts with paying attention to our frontline healthcare workers. We've been very proactive with our platform. We released our long-term care plan this month last year, 2,500 new beds, 2,000 new staff. In the fall, we released our mental health care plan, which is revolutionary, opening up our billing code so that private practitioners in the mental health care sector can bill MSI to reach out and provide services to those people that are in crisis that need help now, not 6-12 months from now, which is the wait time in mental health. On the healthcare perspective, obviously creating long-term beds frees up beds within our hospitals. Those freed up beds speed up the opportunities to do surgeries in a timely fashion. It speeds up the offload times in the emergency rooms because patients that they need to admit have a bed to get admitted to. Just in touching on something that my challenger, Mr. Tilley, said about being on the government side. Well, the government, being the Liberals, have not been on the side of Northside Westmount these past 8 years.
All right, let's bring Jennifer Morrison in here. Jennifer, what are a couple of your priorities?
Well, the first thing I want to say is that there are so many priorities. We have rent control that needs to be established. Our education system has still a lot of work that needs to be done to it. We're looking for a higher minimum wage on the way to a living wage, and we need greener jobs. But at the same time, saying all of those things, I believe that in our riding, the most important things are healthcare, child poverty, and equalization. And yes, healthcare is a priority, but it cannot be the only priority. Nova Scotia has a high rate of child poverty, but not only in Nova Scotia, but in Northside Westmount is one of the highest rates of child poverty in all of Nova Scotia. And the equalization, and I know that can be a contentious issue with some people, and I understand that, but we also have to understand that Cape Breton as a whole has been let down by the equalization process for many years, and it is time that Cape Breton is able to build up again by receiving the information, by receiving the money that they need through transfer payments. So yes, healthcare is absolutely important, but so is child poverty and equalization, education, rent control. There's so many priorities that we have right now in Northside Westmount and in Cape Breton as a whole.
Fred Tilley, what are a couple of priorities for you?
Well, first of all, Wendy, I'd like to respond to Mr. Ryan's comments about the Liberal government ignoring Northside Westmount. $200 million just for a healthcare facility in our area, $200,000 for the Field of Dreams Little League field in City Mines, as well as many other investments. And significant investment in our new cancer center, of which Mr. Ryan voted against in our budget, would really help the folks of Northside Westmount. So over and above that, some of the priorities that I've identified in Northside Westmount are some infrastructure around sewage treatment, around educational facilities. We need to improve our educational facilities. We need to improve our roads. That's definitely. And I just wanted to bring out one of the commitments that I've made is to create a mobile office. So my office will come to people in the riding so they don't have to drive to meet with me. I will come around the riding on different times to meet in different communities. The second commitment I've made is around creating a seniors council, and I believe seniors are the backbone of our community. They worked all their lives to get us where we are today, and we owe it to them to understand what their needs are and their concerns so we can bring that to the legislature. And the third piece that I've done is around youth. I've also committed to a youth council so that our youth are our future. They are going to build this community when we move on and they move into our positions. So a youth council, again, providing youth the answers that they need and help us to bring their concerns to the legislature. Thank you.
And Fred Tilley, Jennifer Morrison mentioned about equalization and that she feels and the NDP feel that Cape Breton is not receiving its fair share of those dollars. What's your position on that?
Yeah, so thank you, Wendy. My position on that is that I've committed in writing online that I definitely want to work with Mayor McDougall and the councillors to actually get in there and determine where we're lacking in the equalization area and be the voice for CBRM within the government to ensure that here in CBRM we are receiving what we are due to receive.
Murray Ryan on equalization?
Wendy, repeatedly over a number of years, my predecessor, Mr. Orrell, and former MLA Alfie MacLeod requested the Auditor General to review the issue of equalization as it relates to the CBRM. At both instances were rebuffed by the Liberal government. Tim Houston has committed to opening up negotiations with all municipalities, including the CBRM, related to the municipal capacity grants and funding to the individual municipalities. While that process is going on, he is committed to doubling the current yearly funding amounts. So currently CBRM receives $15 million a year. So while this process is going on, while these negotiations are active, that will be doubled to $30 million.
You're listening to Cape Breton's Information Morning, and we're speaking with the three candidates for Northside Westmount: Jennifer Morrison for the NDP, Murray Ryan, the incumbent for the PCs, and Fred Tilley for the Liberals. It is coming up to 8 minutes before 8. I'm going to switch tacks for a moment here and ask you, you've told us what your priorities are, but I'm wondering if you've heard anything or any concerns on the doorstep that have surprised you. Jennifer Morrison.
I wish I could say that some of this surprises me. I think they surprise me in the fact of how heartbreaking these stories are. I went to one door and a lady had answered, and she was visibly exhausted and said, I just got home. I brought my mother to the emergency room yesterday at 10 o'clock in the morning. I'm just getting home with her now. And we're talking about an older adult who is bringing her older elderly parent to the hospital. She's in pain, and she's sitting in this waiting room for hours and hours and hours. And she lives on the north side, which means she wasn't able to go to her local ER hospital because that has been closed. So the issue there wasn't just that she had to drive to the Cape Breton Regional Hospital, but it's also because all of the other emergency rooms have been closed, and as a result, the wait times at the hospital have been exacerbated. One story that really shocked me was a man who informed me that his daughter has some serious mental health issues, and partly a result of that was an eviction notice, and he is so concerned he doesn't know what to do. She doesn't have a doctor. She has mental health issues that are going untreated, and now she's being evicted. So we have issues that are just so heartbreaking. Where is this woman going to go? What is she going to do? Who is going to be there to take care of her? And these are issues that are surrounding our riding. It's not just individual cases. There's cases of this absolutely everywhere. I had a lady stop me on the street, and she said, "What are you going to do about education? What's going on there?" And I said, as an educator, I get it. I do. I see every single day the struggles that families are going through. Some of these families, some families do not have enough money to feed their children because their rent is so exorbitantly high that they pay the rent, but they don't get medication or they don't get fed. And, during COVID, during the shutdowns, there were, schools were handing out food to families that needed it because we knew that there wasn't going to be a breakfast for those students. And that's, as an educator, and I go to school every single day and I see that, and it is everywhere. And I think, across Nova Scotia, it is a bad situation. Across Cape Breton is a bad situation. But in our riding of Northside Westmount, we have one of the highest rates of child poverty in all of Nova Scotia. And that is just such a shock to realize that in our society today that we could be living in a riding where child poverty seems to have just gone unnoticed.
Fred Tilley, any surprises on the doorstep for you?
Wendy, the big issues that I'm hearing on the riding are around doctor recruitment, around our healthcare system, and we are hearing lots of stories, but also lots of great stories about the wonderful care that people are receiving in our facilities from our healthcare practitioners, from our frontline healthcare workers. It's phenomenal the work that people in healthcare are doing for our citizens. But around doctor recruitment, one of the things that the Liberal Party has identified that we're going to put into place an Office of Physician Recruitment and Retention. And I believe that putting focused dollars in that area is going to help. But we need more than that. What we need is a grassroots movement to help recruit doctors and healthcare practitioners and help them to stay here. So help them to integrate into the community. The great work that's happening in Glace Bay with the Bay It Forward group, I think, should be replicated across the island. And I've committed to working with many community groups over the term of this campaign. And I think together we can really make some strong investments. The Liberal government is putting an additional $6 million into virtual care, into all health zones, so that people that don't have a doctor can have access. Many investments in Dalhousie Medical School to train more doctors, recruit more doctors. The investment in our healthcare system to modernize our facilities, they will be an attraction for physicians, specialists, healthcare professionals who want to work in the most up-to-date facility with other like-minded professionals. So I think we're doing a great job.
Thank you, Fred. Murray, last word to you this morning. Surprises on the doorstep?
Thank you so much, Wendy. Surprises on the doorstep? No. Healthcare, full stop. That's where people's issues are. The people say, residents are saying the Liberals had 4 years to try and fix the healthcare system, fulfill their promise of a doctor for every Nova Scotian. They hit a dead end there, so then they said, okay, if we build it, they will come with these new health centers. Well, Wendy, this isn't a movie, and it's not the Field of Dreams. Our family doctors don't spend all of their time in health centers. They spend their time in their offices with their patients. And new facilities can be spick and span, but it doesn't solve the crisis. We have institutions, brick and mortar buildings now that are cornerstones of communities, and we can't staff those. I'd just like to touch on a couple of other things.
Very quickly. We have about a minute left.
I'm all about brevity. I've been traveling the riding weekly over the last 2 years to meet with constituents to view their issues firsthand. Things like the 125, I've gotten the government to agree to expand their planned repairs. I've gotten the turning lane on Tobin Road and the Trans-Canada Highway, which was exceptionally dangerous, especially with added traffic. And the Little League ballpark in Sydney Mines, the Nicole Meany Field, when I got involved in that a year and a half ago, the provincial funding at that point in time was $15,000 towards a $300,000 project. And I was integrally involved working with government and the local organization to get that project past the finish line.
All right.
And I'd like to say thank you to all the residents of Northside Westmount for the warm reception over the past 3 weeks, and wish all the luck to my fellow candidates for Northside Westmount. Thank you, Wendy.
Okay. Thank you all this morning. I think we could carry on for quite some time, but we're going to get cut off by the national news. So Jennifer Morrison with the NDP, Murray Ryan with the PCs, Fred Tilley with the Liberals, thank you so much, and good luck on Election Day.
Thank you, Wendy.
Thank you, Wendy.
Good luck, everyone.
Bye.
Tomorrow, we turn our attention to the riding of Victoria the Lakes.
For more CBC podcasts, go to cbc.ca/podcasts.